Sometimes I'm asked why do we say the air is still dirty? It looks cleaner. Back in the heyday, decades ago, when the air looked dirty, those were much heavier particles. Those particles, when we breathe them in through our mouth and nose, those particles would get deposited in your upper airway. They would never make it down to your lungs. It's these small particles, the PM 2.5, that you can't see that are causing these effects. So as far as asthma goes, we have 25 million US citizens with this. About 1 in 11 school-aged children have asthma. We spend over $80 billion a year on healthcare costs. And unfortunately, people still die of asthma. People forget this. We have over 3,500 deaths a year from asthma. And that's very hard to swallow for a specialist like me, because we're able to detect this disease and treat it. We can't cure it, but we can treat it and control it. Many missed school days, which I'll talk about a little bit later on. Adults with asthma are missing work. Parents of children are missing work. Many patients with asthma, if their disease isn't controlled, they're not physically active. And some people will say, well, what's the big deal? They can just take an inhaler and be better. We can't cure this disease. We can control it with certain medications, but those medications do have side effects. And I truly believe the best way to approach this is by primary prevention, trying to prevent a problem from starting. And this air pollution pyramid is true for all the different diseases that are caused and triggered by air pollution. We're going to start at the bottom, and there's going to be pollution exposure. So an example for asthma is that if I expose a patient to air pollution, the first thing that's going to happen is their lung function test is going to change. It's going to decrease. That can happen before they even start to cough or wheeze or feel like they have chest tightness. So that happens first. And then some of those patients are going to move on further and actually have symptoms. In my case, this would be asthma, the cough, the chest tightness, and wheezing, and they're going to reach for their rescue inhaler. Then what's going to happen is they're going to end up calling their doctor or their primary care provider, and they're either going to get a virtual visit or going to come in and see the doctor for an acute exacerbation. Then of those, some of them may have a bad exacerbation and end up needing to call an ambulance and going to the emergency room. And of those going to the emergency room, some are going to end up in the hospital. And unfortunately, again, some can die. And I don't expect you to master this slide, but the blue line on top is showing normal lung growth in a child. And they reach adulthood and it plateaus off. And then as we get older, we're going to start to lose lung function. That's what happens normally. In some patients with asthma, they actually have reduced lung growth. Their lungs are not going to grow to their full potential. And that's because there's inflammation in there, and that's causing scarring, and that prevents the lungs from obtaining their full potential.